Time now for Morning Rounds, our look at the medical news of the week. First up, closing the healthcare gap affecting children across America. This week, the Centers for Disease Control released a new report highlighting some of the health issues that our nation's most vulnerable face and possible ways to address the disparities in care. Here now with more on the report is CBS News contributor Dr. Tara Narula. Tara, what did this report seek to address exactly?
Well, it's trying to address how do we get our kids to reach their fullest potential, and that a lot of these health disparities actually have the foundation or are rooted in early childhood. So those first 8 years are really critical for setting the stage for what kind of success a child has, what kind of health a child has, how their learning will develop. And so stressors in early life can affect children neurologically, metabolically, immunologically. We're talking about things like poverty, things like instability in their home life, lack of quality education. And that can really create a trajectory for a child so that they become at risk or vulnerable. And so we know, for example, that socioeconomic status is associated with language development as early as 18 months. Yep. That vocabulary in a 3-year-old will predict how well they read in 3rd grade, which will then go on to predict whether they graduate from high school, which then has effects on chronic diseases. So kids who don't graduate from high school tend to have more chronic diseases like diabetes. So all of these things are very important and something that we need to start early with.
Did the report identify ways to sort of address these vulnerable children?
So they talked about trying to pick this up early so that we can refer kids early for intervention. And they talked about screening for health disparities socially as well. They talked about identifying kids who may have hearing issues, developmental issues, motor issues, and trying to get them, again, initiated into treatment early on. And then they also talked about this idea that just because you identify that a child is vulnerable doesn't necessarily mean that they will get into a program, because a lot of the programs have strict eligibility criteria. So what we need is more programs like, for example, what they reference, a program called Help Me Grow, where there's really kind of a one information line that parents can call and really help their child get matched with the right program.
Did the study look at what doctors specifically can do? Because this report is obviously about children, but it affects parents as well, of course.
It did. And so, again, it placed a big role on doctors for early identification and early referral for treatment. In particular, they also talked about behavioral issues and mental health. And so we know that in this country, about only 20% of kids with behavioral issues are getting help, mental health help. And so that needs to be addressed. And then they talked about a 2-generation approach. It basically means we're not just targeting the child. We have to target the parents. We have to look at the whole family. So screening and treating for things like maternal depression, teaching parents about self-care for themselves, teaching parenting strategies. If you treat the whole family, you're going to do a better job at helping the child down the road.
They imprint on all the things that we do. Our next topic, the ongoing battle against multiple sclerosis. It's a debilitating disease that impacts an estimated 400,000 Americans, and there is currently no cure.
But new research at New York's Mount Sinai Hospital is examining how diet can potentially play a role in the fight against MS. Tara takes a closer look.
We'll just go around and hear an update from everyone.
Once a month, this pioneering group of MS patients meets to get tips from a nutritionist.
When grains are refined, they're stripped of this outer layer.
And share their temptations.
I was craving a hamburger or something terrible the other night.
They had lobster crepes, and there was just no way I was going to pass that off.
Neurologist Ilana Katz-Sand is leading one of the first clinical trials to study the link between what we eat, gut bacteria, and MS symptoms.
Why did you decide to investigate diet and its link to MS?
The gut is actually kind of a natural place to look, and that's because the immune system, about 70% of it, lives inside the gut and has far-reaching implications throughout the rest of the body.
In MS, inflammation occurs when immune cells attack the brain and spinal cord. This study is testing whether a dietary intervention can reprogram the immune system to slow down the assault on itself.
So this right here is a very typical looking spot for MS.
Corinne Providence and the other patients enrolled in the trial are following a strict Mediterranean-style diet. No processed food, dairy, or meat, but lots of fruits, vegetables, and whole grains.
Why did you choose that type of diet?
We think that those are anti-inflammatory. We also think that they're neuroprotective.
Symptoms like fatigue, difficulty walking, vision problems, and cognitive changes can be severe and disabling.
But it can take a very heavy toll on patients.
I was really fearful because, I have a family, I have my children, I have my husband, and I felt like as if my life would just be over.
With the help of medication, Corinne is still able to work nights as an oncology nurse, 4 years after her diagnosis.
Have a pleasant day.
For her, sticking to the diet is a small sacrifice for better health.
No chocolate chip cookies, no dairy, no vanilla ice cream that I love so much. But if I can participate in a diet that can change my life, give me longevity, give me a piece of how I was before, I don't mind.
Thank you for everything. You're welcome.
Well, fascinating, Tara. How unusual is it to approach treating MS through diet?
It is new, but it's something that's happening across a lot of different fields in medicine.
Yeah.
One of the things that came up when we talked to these patients is giving them a sense of control. That's what this is doing. And for diseases like MS, patients mentioned they may look well on the outside to people. People may think they're not sick, but they suffer from things like inability to walk, bowel or bladder incontinence, trouble with their vision. It really is, or can be, a very crippling and disabling disease. So giving them something very small, like changing their diet, allows them to feel empowered, which is so important.
You said it in the piece, a small sacrifice, but it makes a big difference.
Yeah,
exactly.
Huge difference. All right. Finally, using technology to improve the lives of children with cerebral palsy. These children commonly experience something called crouch gait. It's due in part to abnormalities of the hips, knees, or ankles and can impact range of motion, making basic things like walking difficult.
A team of researchers at Columbia University's Department of Engineering tested the use of a cable-driven robotic training device. The device applies force on the pelvis. Research published in the journal Science Robotics showed not only improvements to posture, but also strengthening of the children's lower limbs. It's fascinating that robotics can be used like this again.
It is. And when you think of the numbers, about 4 out of 1,000 school-aged kids are diagnosed with cerebral palsy. And this abnormal gait or abnormal walking can lead to joint degeneration down the road.
Sure.
And where we stand now, we don't have a lot of options physical therapy-wise or strengthening exercise to offer. So something like this could make a really big impact.
Fascinating. Dr. Tara Narula, thanks.